Welcome to Winters Wellness Center. This is Dr. Winters, and I want to share with you some information about the chiropractic neurological side of our practice. We get lots of questions on what we do and why. We use instrument adjusting. The reason that we use instrument adjusting is it's very gentle on you, there's no twisting and there's no popping, and that takes the fear out of getting chiropractic care away for a lot of people. It's extremely gentle, but that doesn't mean that it's not powerful. In some ways, it can be more powerful. This instrument that we use is called an arthrostim. It taps at 12 times a second. That's 12 times a second. So it's bombarding the nervous system with information, and when we do that at the right place in the right time, it makes tremendous changes in the nervous system. Now, many people are familiar with chiropractic care where the joints pop. There's nothing wrong with that, but this does the very same thing. Again, I emphasize it does the very same thing. It just doesn't open up the joint far enough to make a popping sound. So this is extremely gentle, but it gets the job done. So in all the mechanical nerve endings of your spine, in all the joints, there's mechanical nerve endings, and as we tap here, that's feeding information into that nervous system along the right pathways, and some of that information even reaches the brain to help balance the brain. While I'm on that subject, more and more we're incorporating neurological activities or exercises in with our care to help balance the brain. Everybody has one side of the brain that fires at a lesser rate than the other side, meaning one side needs more stimulation than the other to bring them into balance. That imbalance produces many neurological conditions, anywhere from ADHD to learning disabilities to other problems in our nervous system. So bringing that into balance can help many health problems. So some of those neurological exercises may be doing things as simple as running this, what's called optokinetic tape. We'll run this in front of a person and have them watch it with their eyes. We'll do it in a certain direction to stimulate a certain side of the brain. I may also have people smell something, maybe even while I'm adjusting them. That sense of smell, if I have them smell something in the right nostril, it goes right up into the right frontal lobe of the brain. I may snap my fingers in their ears. I may do other things to, again, feed more information into the nervous system in the right way. And we've determined where we need to feed that information in during your initial exam process. These are some of the high-tech things that we do at Winters Wellness Center to bring more improvement in the neurological aspect of our health. Again, we work with people neurologically and metabolically, and you'll also want to watch our metabolic video as well. Now, we assess people in a real-time way, versus taking an x-ray on someone and going by that x-ray, adjusting them by that x-ray for the next 6 months. One day out of that x-ray, your body is different than it was when we took the x-ray. There's nothing wrong with x-ray for diagnostic information, but to decide where to adjust, to me it doesn't make sense, because I want to know what's going on with you that day and where your body needs input that day. So we use a different type of analysis called the Occipital Drop, and I have a whole video on that, Occipital Drop. It's on our website and on our YouTube channel. I want you to watch that. So that's what I'm doing at the base of the skull, is I'm checking that occipital drop to get feedback on where to adjust your body and to go through certain priorities that are needed for you that day. And so your adjustment that day is going to look like unlike your adjustment the next day or the next day. Each adjustment is going to be different, and the person that got adjusted before you is going to be different than you, and that's going to be different than the person after you, because we're going to get real-time information from your body by doing that occipital drop, and I want to refer you to that video to watch that. Now I'd like Debbie to come up here into the camera, and we're going to do an adjustment so that you can see what this looks like. So I'm going to be assessing her at the back of the skull here, checking that occipital drop. and it's giving me information that I need to work with here in the middle of her back. So I'm going to bring my instrument in here and tap, tap, tap. I may want to adjust the rib also, and that's got the middle part of her back adjusted. Now I'm going to go through different priorities, get that information, and I'm going to adjust an area a little bit lower here in her thoracic spine as well. We could adjust areas in her tailbone, in her neck. Again, there would be no twisting or popping, just tap, tap, tap. Very simple and very gentle. Now, you may notice we're adjusting a person standing. Most chiropractic offices are adjusting a person laying down. It doesn't make sense to me because you don't live most of your life laying down. You don't get out of alignment laying down. How often do you hurt yourself laying down? So when you're standing, we have all the neurological input from your feet, your ankles, your knees, your hips into play that we would not have into play if you're laying down on a table. So that's one of the reasons that we adjust you standing. It makes more sense to me. We also adjust people sitting. We also adjust people in various postures. This is one of the great assets that we have with this technique called core and specific technique, is to adjust people in different postures or positions. For example, I could assess Debbie, just raise your hand up above your head, your right hand. And if something's going out of alignment when she raises her hand, I'll tell it by this occipital drop, and then I may adjust a certain area. So go ahead and put your hand down. And now I'm going to adjust this area while she raises her hand. So raise your hand up and down. And we're going to adjust it while she's doing a motion. Now the great part of this is that we can adjust people in various positions. I have people where I check them in their golf swing. I check them in their back swing. If something shows out of alignment there, we adjust them. I check them when they address the ball, just going through the motion. If something shows up, we adjust them there. I've adjusted people in their tennis swing, in their baseball swing, all kinds of positions. It's just unlimited in what we can do with this technique in adjusting people in what we call the position of subluxation, meaning that you may not get out of alignment until you take a certain swing with the bat if you're a high school baseball player, or you may not get out of alignment till you reach up above to do windows or whatever you're doing at your home. So there's certain positions that give us more trouble, and we can assess people in those positions and actually adjust people in those positions. We can actually even adjust people in different emotional postures. That means we can have them think of something that's stressful, that causes their spine and nervous system to react, and then while they're thinking that thought, we can assess where to adjust and clear out the nerve interference in their system. And what that does is it breaks the connection between that thought and their body reacting neurologically. Sure, it doesn't take away the memory, but it breaks the cycle again between that thought and your body reacting to it on a neurological level. So if you're having something that's chronically stressing you out and causing you to tighten up, we can break that cycle, and it does a tremendous amount to make the adjustments more effective and work longer for people. So this is some of the things that we can do with core and specific technique and the chiropractic neurological aspect of our healthcare. I want you to watch our metabolic videos also, watch the occipital drop video that explains this assessment, and we look forward to helping you, assist you in you having the best health possible. Thank you.